gonna move this chair because I'm a walker when I talk. Let's just hope I don't trip over anything. It's fine if I do, it's no big deal. Got my napkin and bullet points here. Hopefully I'm gonna stay on track, but I'm also notorious for getting up and talking and not remembering what I am gonna say, which we were just talking about, but then also just kind of taking tangents. So just bear with me. One of the things that I have learned over the last year through medical issues and different things like that is that we need more leaders and more presenters and more speakers who are very willing just to be their most human selves in front of crowds. And that can be very, very hard because we live in this society that values this very professional and strict persona. But in reality, that's not what gets people. Like the mayor said, that is not what gets the buy-in, right? I would much rather hear a presentation from somebody and they tell me about their family and their golden retriever and all of these different things and their struggles with, IBS and all of these things. I would rather hear all of that than hear someone just drone on for hours and hours and be very professional and put together. So you're gonna see me be very human. I'm going to try to keep this brief, but tonight I'm gonna talk about why we have to build bigger tables across Southern Illinois. When I say building bigger tables, what I'm talking about is this intense need for collaboration between systems, between organizations, between agencies. We have to have collaboration. So I'm going to give a little bit of background on me. I have been in this field. When I say this field, I mean the field, I feel like this makes it sound more fancy, child and family serving systems for about a decade. That means that I have a variety of experience. I was actually a special education teacher for 5 years at an alternative high school. I also have worked in the child welfare sector. I came from my most recent position from mental health and then somehow landed in this beautiful world of substance use disorders. I remember one of my very best friends, one of the best bosses that I ever had. I remember her telling me, Megan, if you ever got into the substance use and recovery field, you would love it. You would find your home. And I'm like, no way, not for me. I'm a mental health girl to the max. Give me that. Well, I'm eating my words now. Because what I have found in the substance use community as far as treatment, recovery, especially the recovery community, is really a home and a family that I never expected to have. This is some of the people that I get to work with every single day and the people that I get to collaborate with on a regular basis are literally some of the most amazing individuals that I think our community is just so blessed to have them. And so this is why we have to collaborate. Whenever we fail to collaborate, one, we are building more silos. So you guys have, I'm sure many of you have heard of this concept of system of care, right? We like to throw it out there as a token word, right? It's a hot button issue. We like to talk about it, how we need a better system of care. We need a system that's easier for people to navigate. But in reality, what we have seen, or what I have seen over the past decade, is that this is much more of a token statement than something that's actionable, than something that we actually are like putting our money where our mouth is. And a lot of it comes down to money. I will tell you that. If you're familiar at all with the systems, the various healthcare systems all across Southern Illinois, you know that people love to talk about this concept of system of care, but whenever it comes to taking actionable steps to actually coordinating one system or entity with another, that's when we run into barriers and roadblocks. It's very, very difficult. And what this does is it creates more silos. So when I say silos, I mean more we have a silo here, we have a silo here, we have a silo here. And all of these silos are operating different. All of these silos are operating independently. And what this does is it makes it way more complicated for the most vulnerable people in our society to be able to be successful. Whenever a person has to go between multiple organizations, multiple silos, it makes it very difficult for them to be successful. Just one story that and I'm sure all of you have heard of these stories, thinking of from in the child welfare area. How many times, I can't even tell you how many times I have talked with or worked with parents, and they will come to me and say, I've done this at this organization, I've done this at this organization, and I've done this. And I'm like, okay, that's great. And then they say, but my caseworker says that it only counts if it's this specific thing, right? Or if it came from this specific place. And so then this parent who is already in a vulnerable position, who is already probably impacted by things like poverty, potentially substance use, all of these like social determinants of health factors that we see across Southern Illinois, just they impact our people at a much higher rate because we're rural. They are forced to basically start from square one because these systems aren't communicating with each other. So not only are we creating these silos, but we're making the bridges between the silos near existent or non-existent, basically, okay? So why do we have to collaborate? One of the things that I hope if you know me, it comes through. The most important thing for me is connection and relationships. Above all, above money, above profit, above success, above everything, I value connecting and having a good relationship with people. That is why you will often see me, when I'm writing grants, pulling in a bunch of different organizations because I want to work with everybody. Crystal and I were just talking earlier that, it has always been my dream, and I always kind of got laughed at for this, but I always said, I don't want to be proprietary to any one organization. I want to work with everyone, right? I feel like we all have a skill set. We all have things that we're really good at. We all have our areas of strength. And whenever we are bound in the walls of one organization, it really limits the impact that we're able to have on the community. And I'm not saying the impact that we're able to have are in ourselves, but it limits the impact that we're able to have and by training people, by teaching people, and by raising up other leaders in addition to us. So we have to collaborate because of that. Another reason why we have to collaborate, and this is probably the biggest one of all. In Southern Illinois, the problems, the issues that we face are bigger than any one agency can handle. We face poverty at absolutely disproportionate rates. A lot of you might know that I do a ton of work in data, and I feel like I've had my nose in the census data for the past 2 weeks. But one thing that I notice is that as we have written grants, and I look at data from 10 years ago as compared to now, things have not really changed, right? Things have not really gotten better. People are still poor. People are still using substances. People are still losing their children because of lack of resources. These things are still happening. And that's because our systems are not working together. I'm a firm believer in that. That is because our systems are not working together and they are not making it to where these people can be successful by creating bridges between our different organizations. The problems that we have are way too big for one organization, which is why we have to draw on the strengths of all of our organizations, right? When I think of recovery services, I think of Take Action Today, right? When I think of resource services, I think of, little plug for my own thing here, I guess. I think of the Southern Illinois Resource and Advocacy Center, which many of you probably haven't heard of, and that's because it's brand new. But it is a resource center that is basically just about filling the needs and gaps in Southern Illinois. We're not a treatment organization. We're not clinical. It's really just about making sure that people have their basic needs met so that they're able to live their best and most fulfilling lives. We have to work together. Collaboration is essential. If we don't work together, we're doing a very huge disservice to the people that we are serving and to our communities. Next thing is that when we're talking about Southern Illinois, we're talking about rural, right? Most of our communities are very rural. I come from Gallatin County, community of less than 5,000 people. Actually, I read an article a week ago from illinoispolicy.org that said that Gallatin County is the fastest shrinking county in the entire state of Illinois. Yeah, in the last year, guess how much our population shrunk? 1 year, 2020 to 2023. 30%. 30%. Yeah. Why that's happening? I have theories. In Gallatin County, we don't have very much of anything. We're a food desert. We have one sole Dollar General that is our grocery store for the entire community. And it's not even a fancy DG marketplace. It's just an old-fashioned one. We have a very large aging population, right? So that's another factor. And then our young folks are getting the heck out of Dodge once they graduate high school, okay? So me, I've been there my entire life. Moved away, went to college, did all that, came back, brought my husband from Harrisburg. He's a Gallatin County boy now. He belongs. It's okay. I forgive him for those first 18 years in Harrisburg. But when we are rural, we are talking about very specific challenges, right? We're not just talking about lack of resources, which we are all incredibly familiar with. We're also talking about things like lack of transportation, right? Things like lack of food access, things like lack of good paying jobs. In Gallatin County, there are only 80 employers, okay? 480 jobs open in Gallatin County. That's it, the entire county. I know that because I did that research recently. 480 jobs in a county with a population size of 5,000 people. We have such limited opportunities that if we do not collaborate and work together, we are limiting ourselves further. And again, doing a disservice to the communities that we want to help better. We also have to recognize that there is significant power in collaboration. A lot of times agencies and organizations don't want to collaborate because they have this scarcity mindset, right? Like, if I work with them, then that's gonna take money out of my budget, right? Or if I do this, then that's gonna take services away and my ability to get some income from those services. And while I understand that, because I will tell you, being the person that I am, like the person that's always shouting like, collaborate, collaborate, I still immediately, that knee-jerk reaction, especially now starting a new organization, is, ooh, I don't know if I want to share, right? So that's a gut check. You've got to check yourself because that we're human, right? And unfortunately, being raised in rural environments, being raised where there are few resources, we are taught and conditioned to think in this scarce mindset, okay? But whenever we get over that, and whenever we move past that scarcity mindset and kind of check ourselves that, no, this isn't less for me, this is more for the community, which amplifies my ability to make an impact in the community, right? It amplifies the ability to enhance life in the community for the people that I want to support and I want to see live their very best lives. Collaboration also leads to some amazing, innovative thinking, which is so cool. Recently, Mike and I collaborated with another organization on a grant application, and I am just crossing my fingers and hoping and praying that this gets funded, because if it does, it is an incredibly innovative approach to a very big workforce issue that we have in Southern Illinois. Collaboration breeds innovation. You have to collaborate to get new and creative ideas. Whenever we're only working with ourselves, with our own organizations, we're essentially working in echo chambers, right? Nothing new could come out of that. And if it does, it might be a little new, but it's not going to be as great as it would if you are bringing somebody with a different mindset, a different perspective, right? A different area of expertise. I love working with people who are in recovery, people who are in the recovery support space, because they bring a completely different perspective to things than I do being a social worker. It makes me think differently, it makes me approach problems differently, and honestly, it makes me a much more effective leader because I'm able to think in a different way and think from a different perspective than the one that I was trained for 4 years or 6 years to think in. Lastly, I want to say that collaboration helps to ease the burden that this work can be sometimes, right? We're all familiar with it. We all know that burnout is a very big issue in this field. We know that there's never enough staff to go around, never. There's always more clients than what we have staff available for. We have huge caseloads, all of that. Collaboration turns a solo race into a team event, and that makes a difference. That makes it to where we are able to sustain our passion and our drive for longer. I will tell you that when I am feeling my most burnt out, when I am feeling like, why am I even doing this? I don't want to do this anymore. What is the point? I'm not making a difference. I'm working in a system that I hate, all of these things. Let's just be real here. Whenever I'm feeling these things, the best thing that I have found for myself is to have a meeting with somebody that works at a different organization or works in a different capacity. Because when I hear them talk about the things that they're doing, it sparks creativity in my brain. And then we get to talk about different things that we can do together, right? So now, me trying to run this race and save the world, for lack of a better phrase, it's no longer just me. I'm not in it by myself, right? I'm in it with a team. I'm in it with people who also want to see the community succeed, who also want to see Southern Illinois be a better environment for generations to come. I don't know how to wrap this up. Just thank you for giving me this space. I have no idea how long I talked just now. I really, really appreciate honestly, the different organizations that we have around Southern Illinois, the ones that are willing to collaborate and share the resources and share, I don't want to say share the success, but just the ones that are willing to share and work together, because honestly, those are the ones that are going to last and stand the test of time. Those are the ones that are going to make a real, tangible difference across Southern Illinois. So there's my closing. Thank you. Thank you. Thank you.